Chemotherapy for tuberculous meningitis. Definition: tuberculous meningitis is also known as TB meningitis. This is a Mycobacterium tuberculosis infection of the meninges that initiates an inflammatory process. The meninges is the system of membranes which envelop the central nervous system.
It's estimated that about 2 billion people worldwide are infected with Mycobacterium tuberculosis, often just shortened to tuberculosis or simply TB. 2 billion is a lot of people, right? But even though they're infected, that doesn't mean that all these people have symptoms. The vast majority, about 90 to 95%, aren't even aware that they're infected. And this is because usually the immune system can contain it such that it isn't able to multiply, and often it remains latent or dormant, as opposed to active, which usually causes symptoms and means it can be spread to others. If the host immune system becomes debilitated at some point down the road, like with AIDS or some other illness, or as a person grows older, it can be allowed to reactivate, or basically wake up and become very serious, especially if it spreads throughout the body. Mycobacteria are an interesting bunch. They're slender, rod-shaped, and need oxygen to survive. In other words, they're strict aerobes. They've got an unusually waxy cell wall, which is mainly a result of the production of mycolic acid. Because of this waxy cell wall, they're acid-fast, meaning that it can hold onto a dye in spite of being exposed to alcohol, leaving it a bright red color when a Ziehl-Neelsen stain is used. The wall also makes them incredibly hardy, and allows them to resist weak disinfectants and survive on dry surfaces for months at a time. Now, Mycobacterium tuberculosis is usually transmitted via inhalation, which is how they gain entry into the lungs. Now, we breathe in all sorts of virus and bacteria all the time, but we've got defenses to take care of most of them. For one, air that we breathe in is turbulent in the upper airways, and drives most bacteria against mucus, which is then cleared pretty quickly. Ultimately, though, TB can avoid the mucus traps and make its way to the deep airways and alveoli, where we have macrophages which eat up foreign cells, digest, and destroy them. With TB, they recognize foreign proteins on their cell surface and phagocytize them, or essentially package them into a space called a phagosome. With most cases, the macrophage then fuses the phagosome with a lysosome, which has hydrolytic enzymes that can pretty much break down any biochemical molecule. TB is tricky though, and once inside the macrophage, they produce a protein that inhibits this fusion, which allows the mycobacterium to survive. It doesn't just survive though, it proliferates and creates a localized infection.
Application in medicine. The key to eliminate tuberculosis, TB, is to apply the optimum treatment, in which it consists of chemotherapy to patient to restore health. The anti-tuberculosis therapy is a unique two-phase chemotherapy consisting of initial intensive phase with multiple drugs. The multi-drug initial intensive phase is given to take care of the drug-resistant organism and to achieve a quick heal to reduce the vascular load. The optimum duration of chemotherapy is about 9 months.
Meningitis. Meningitis is inflammation of the meninges, the protective, membranous covering of the central nervous system, due to bacterial or viral infection that spread into the cerebrospinal fluid, causing headache, fever, and rigidity of the neck muscles.
The treatment is the use of streptomycin, isoniazid, and rifampicin daily for about 10 months, ethambutol plus isoniazid for 2 months, and steroid for initial weeks.
Treatment for latent TB infection typically involves using a single drug for a prolonged period of time. The most common approach is isoniazid for 9 months. Treatment of active TB disease is typically a combination of antibiotics, which results in patients being non-infectious to others, usually within a few weeks. Until that point, though, patients can spread TB to others, and it's typically adults with reactivated TB that are the most infectious. As a result, patients are typically kept in negative pressure rooms, and visitors are asked to wear protective N95 masks that can't filter out oil aerosols, and for not resistant to oil. but can filter out at least 95% of other aerosols, in this case, TB. Even after patients are no longer contagious, they're typically kept on multiple medications for many months to be sure that the bacteria are destroyed, usually with direct observation therapy or DOT, where somebody watches and confirms that you're taking the medications.
Issue applied in Ecuador. All patients admitted for tuberculosis between 2000 and 2004 at the Eugenio Espejo Hospital, a major public care center located in Quito, in which they usually apply anti-tuberculous treatment, in which they consist of chemotherapy or multi-drugs. Chemotherapy is an expensive treatment. Approximately 50% of patients were aged less than 3 years. On admission, 13% classified as a stage 1, 77% classified as a stage 2, 9% classified as a stage 3. Statistics and publication and a global point of view. Drug resistance.
Drug-resistant strains of TB that are causing infections in various parts of the world. You may hear about MDR-TB or multi-drug-resistant TB, or even XDR-TB, which is extremely drug-resistant TB, which are incredibly hard to treat because they don't die in the presence of our usual antibiotics. The bottom line is that to get an effective treatment, it's super important to make sure that the drugs being used will work against the specific strain of TB, that multiple medications are used together to prevent drug resistance from developing, and that medications are used for the entire course of therapy so that all of the mycobacterium tuberculosis is killed off.
Yeah. Pros and cons of chemotherapy for tuberculosis. Disadvantage. The most common toxic effect were due to streptomycin, which caused vestibular damage in a large number of patients. Prolongation of chemotherapy increased the risk of toxicity. There is a scarcity or controlled trials of anti-tuberculous drugs in the central nervous system, and there is also some hepatotoxicity. Pros. A major advantage of giving chemotherapy directly is that the drug don't reach other parts of the body. This treatment, despite its adverse effects and toxicity, is the mainly option to cure TB. If the treatment is applied correctly, there are high odds of preventing further complications.
Tuberculous meningitis is a serious bacterial infection of the cerebrospinal fluid, and up to 1/3 of patients die despite treatment. Therapy for tuberculous meningitis is based on data for pulmonary tuberculosis, but the standard treatment may not achieve sufficient drug concentrations in cerebrospinal fluid. The standard treatment consists of pyrazinamide, ethambutol, isoniazid, and rifampin at 10 mg per kilogram per day for 3 months, followed by isoniazid and rifampin for 6 months. In this study, investigators asked whether using a higher dose of rifampin and adding levofloxacin could improve outcomes in tuberculous meningitis. At 2 medical centers in Vietnam, 817 patients with tuberculous meningitis were randomized to receive either the standard treatment or intensified treatment. For the first 8 weeks, patients in the intensified treatment group received the standard treatment plus levofloxacin, with their dose of rifampin increased to 15 mg per kilogram per day. All patients received adjuvant dexamethasone. About 43% of the patients were HIV positive. There was no difference between the two groups in 9-month mortality rates. 113 patients died in the intensified treatment group as compared with 114 patients in the standard treatment group. And there were no differences based on patients' HIV status. The overall number of adverse events did not differ between treatment groups. Thus, intensified treatment with higher dose rifampin in the standard regimen plus levofloxacin did not improve outcomes in patients with tuberculous meningitis. Full study results are available at nejm.org.
Conclusion. TB meningitis occurs when Mycobacterium tuberculosis invade the membranes and fluids surrounding the brain and the spinal cord. Normal antibiotics don't kill Mycobacterium. You need to take a special combination of antibiotics for several months to achieve the therapeutic effect. Concluding consideration.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks, and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.